going to be your student nurse today. Is it okay if we do a head to toe assessment?
Yeah, that's fine.
Okay. Let me go confirm hand hygiene and then put gloves on, okay?
Okay.
Okay, and I'm going to provide privacy. And I'm just going to raise the bed just so it's easier for me to work, all right?
Okay.
Can you tell me your first and last name?
Mary Kate Buchanan, 12197.
Perfect, thank you. Can you tell me where you're at?
I am at the hospital.
All right. And what got you into the hospital?
I'm having some stomach pain.
And then what is today's date?
It is September 16th of 2020.
All right. Just going to see if my patient is alert. Only 10 times 4. And you said you had stomach pain?
Yes.
Okay. How long has this been happening?
Since yesterday.
Okay. And that's why you're in here?
Yes.
Okay. And if you had to describe the pain, is it like a throbbing pain or like a numbness?
It's like a dull pain.
A dull pain? Okay. And if you had to rate it on a 0 to 10 scale, 0 being no pain, 10 being the worst pain, how much pain are you in?
Right now it's about a 2.
And is that comfortable?
Yes.
And have you had any treatment for this pain?
Yes, I received a pain pill about 2 hours ago.
Okay. Has that helped?
Yes.
Okay. And where would it be at if you could just like point to it?
Just in like the upper right.
Upper right?
side.
Okay. And does it just stay there or does it move around?
It just stays there.
Okay. Is it okay if I take a look?
Yeah, go ahead.
I'm just going to move your gown up just a bit. All right. So I don't see any distension in the abdomen. There's no bumps or lumps that I can see. The breathing is normal. I also don't see any scarring. Have you ever had surgery?
No.
No? Okay. And I also don't see any open wounds. Do you have any open wounds anywhere?
No.
No? And I also don't see any drains. Do you have any drains?
No.
Is it okay if I take a listen to your bowel sounds?
Yeah, go ahead.
Perfect. All bowel sounds are present in all 4 quadrants. I know you're in pain in the upper right. Is it okay if I still palpate? I'll just go easy on the area, okay?
Yeah, that's okay.
Don't feel any edema. I don't see any edema. And I also don't feel any bumps. No bruising, no redness. The temperature of the skin is normal. The moisture looks normal as well. How are you doing with the pain?
I'm okay right now.
Okay. Can you tell me when your last bowel movement was?
It was this morning.
This morning? And was that normal for you?
Yes.
Yes? Okay. And can you describe the color and consistency?
It was brown and solid.
Brown and solid? Okay. Are you constipated or do you have any diarrhea?
No.
No? And do you have any nausea or vomiting?
No.
What about, can you pass gas as normal?
Yes.
Okay. And how about your diet? Could you explain to me what you would normally eat in a day?
For breakfast, maybe like some oatmeal, or like pancakes, and then for lunch, usually a sandwich.
Okay, okay. And has your appetite changed at all from being in the hospital or at home?
No, they're treating me pretty well.
Hey, there you go. I don't see any restraints on you, which is good. Okay, so since I'm completed the abdomen, you just let me know if there's any issues throughout the process, okay?
Okay.
And since it is all process, do you need to use the restroom before we get started?
No, I don't.
No? Okay, so if my patient did need to get started or need to go use the restroom, I would watch their gait as they walked to see if they were using any assistive devices. So I did place a hat into the toilet. So don't be alarmed whenever you do see it. Just urinate as normal. It's just there so I can check the color and the clarity of the urine. And then just to make sure there's no abnormal odors, okay? Okay. And the last time, whenever you did urinate, did you notice any odors that's not normal?
No.
No? Okay. And did you have any pain?
No.
No? How was your stool?
It was good, I guess. It's
Just normal?
Yeah.
Okay. No dribbling?
No.
Okay. Do you have any frequency or urgency whenever you urinate?
No.
No? Okay, okay. Well, it looks like you're doing pretty well.
Yeah, I feel okay.
Okay, so I'm just gonna ask you a few more questions, okay?
Okay.
So you said you got to the hospital yesterday?
I did.
Okay. Who brought you to the hospital?
My mom.
Your mom? And would you say your mom is your support person?
I would, yes.
Okay. And do you live with your mom?
I do.
And do you guys live in like a one-story house or two-story house or apartment?
We live in a two-story house.
Two-story house? Okay. Okay. And do you need any special beds or accommodations for living or staying at the hospital or at home?
No.
No? Okay. Do you work around here?
I do, yeah.
Okay. And what do you do for work?
I work at Memorial.
So fun.
I know, I'm a CNA there.
Wow, so you're comfortable in this situation?
Yes.
Okay, so I'm going to take a look at your head, okay?
Okay.
So I don't see any redness or bruising. The moisture is normal. There's no dryness in the hair, which is great. I'm going to take a look at your eyes. Okay, can you, I'm going to turn off the light, and then can you look straight for me? Perfect, and the pupils are round and equal and reactive to light at a 3 millimeter. I'm noting that sclera is nice and white and the conjunctiva is nice and pink, which is great, and there's no drainage coming out of the eyes, which is also fantastic. Can you shut your eyes for me? I would turn back on the light. And then can you tell me where I'm touching?
On my forehead.
And right here?
My right cheek. My left cheek. And my chin.
Perfect. I'm going to take a look into your ears. I don't see any redness or infected earwax. Do you have any tenderness?
No.
And what about this side?
No, I'm good.
No? Okay. And do you normally wear any glasses?
I do not.
You don't? Okay. And what about any hearing aids?
No.
No? Okay. And I'm going to take a look at your nose. Septum looks midline. There's no drainage coming out of there, no redness or sores. Can you follow my pen?
Yes.
Perfect. Looks great. And then can you take a look at my pen and then look in the distance? My pen, the distance. My pen, the distance. Perfect. Take a look into your mouth. Can you say ah? Perfect. The dental work looks nice and good. There's no broken teeth, and then the mucous membranes are nice and pink and moist. Your tongue is nice and pink and moist as well. No scarring or sores. Can you turn that way for me? And then turn this way? And then up and down? You have any pain?
No.
Can you raise your shoulders? And then shrug them with some resistance? Perfect. And then can you turn my way with some resistance? And then turn the other way with resistance? Perfect. You doing okay?
Yeah, I'm good.
So I'm going to just feel your neck. Okay. Just looking for any bumps or lumps. Okay, don't feel. And I'm going to check the carotid pulse.
Okay.
Well, I'm just going to check to make sure there's equal rising.
Right, equal bilaterally by 2. You're doing great. I'm also checking for skin trigger, which is non-existent. I don't see any edema on the chest, which is also great. Can you give me a big smile? Cheese. Perfect. The facial symmetry is also intact. There's no droopiness on either side. I'm going to listen to some lung sounds, okay?
So it's just the start of a cardiovascular assessment. So what I'm going to do here is I'm going
Should have you breathe in,
to check your
breathe in,
aortic artery here, which
Breathe
is
in.
the second intercostal space on the right side.
breathe in,
And I'm checking the valve. Just
Breathe
this
in.
breathe
breathe in,
Go forward.
Breathe in.
Just the second intercostal space on the left side.
breathe in,
Sounds
breathe
clear.
in,
I'm going down to the tricuspid valve, which
breathe
is
in.
the third intercostal space on the left side.
Perfect. Your lung sounds are all clear, and all the quadrants I checked.
Mitral valve.
How's the abdominal pain doing?
It's good right now.
Doing okay?
60 seconds.
I'm now just going to listen for some heart sounds, okay?
Okay.
And this one is located in the fifth
So on the
intercostal space.
right, second intercostal space down for aortic.
Lots of funny words to say halfway down your chest.
And then on the left, second intercostal space down for pulmonomic. And then fourth intercostal space down for tricuspid on the left. And then mitral is fifth intercostal face down, mid-clavicular for 60 seconds, okay?
And so you're going to flush it. We're acting like we have a saline lock without an IV infusion. So at what rate are you going to flush it? So you just gave a med, now you're flushing afterwards.
60 even. Very nice.
So what you going to flush in that rate?
Alright, so from here, I'm actually gonna get this down back on you. And I'm just gonna check and make sure we're doing okay. So that calf that was bothering you, has the pain changed at all since we started? It's about the same. About the same. And could you give me a scale on that pain from 0 to 10, 0 being no pain, 10 being the worst pain really at all?
About a 2.
About a 2. Okay. And you think you can manage with a 2?
Oh, yeah.
Okay. So you don't want to find any medication?
No.
All right, your pulse is a 72, which is in normal ranges. How is that abdominal pain?
So,
I'm good. Okay.
I'm just gonna ask you a couple more questions.
I don't see any redness or sores on the chest area.
How's your appetite then?
Just want to make sure, do you have any fears or anxieties about being here?
Any
I do
nausea or
not.
Do you have
vomiting?
any fears or anxieties about being home?
No.
Okay, so I'm just going to note that the patient has normal behavior for being in the hospital. Okay.
I mean, who else is there?
I'm going to go check your arms now, okay?
About,
So I'm just looking at them, inspecting them. In the skin, I don't see any redness or bruising from the site. I do see you have an IV site. Is that giving you any trouble?
No, it's good.
I don't see any signs of infection or drainage, and the bandage is still there, so we're doing great. I'm going to check your pulses.
Respect.
I'm going to start with your radial.
So what I'm looking for here is drainage devices.
Have an
or
equal bilateral by
extension.
2.
I don't see either of those
And then
two
your
things.
ulnar.
So I'm gonna go ahead and listen.
This is also equal bilateral by 2. And then I have your
These are actually my
brachial.
favorite because until recently I've never done this.
Your equal bilateral by 2. And then I'm just going to check your temporal. Equal bilateral by 2. You doing okay?
Starting to
Yes.
bottom line because
Can you raise your arms for me? Up and down?
here,
Good job. And can you do it with some resistance?
all 4 of these.
There you go. And then can you wiggle your fingers? Wiggle, wiggle. Perfect. Can you tell me what finger I'm touching?
My index finger.
Uh-huh. And then what about now?
My thumb.
Usually cause.
And I am checking that the nail bed and color is normal. There's no cap
I did
refill.
have positive noises in all 4 of those.
And then can you grip my
So now
hands?
what I'm going to do is I'm going to go ahead and
Perfect.
just gently I'm going to look for
I don't see any joint swellingness, stiffness, or tenderness. Do you feel any pain in any of your joints?
No, they're doing good right now.
And do you have any numbness or tingling anywhere in the body?
No.
No? Okay. And I haven't noticed any tattoos or piercings. Do you have any of those?
No, I do not.
No? Okay.
and on down the eye and then I'll check with the
So now I would go down and check your peri area. Just before I do that, I'm just going to ask a few questions, all right? Okay. So since you didn't need to urinate, I told you that there was a hat in there, so to use next time.
Kind of a light yellow.
We just want to check for the color or anything, okay? Okay. Any pain that you're having down there, anything like that?
No.
Okay. And do you have any itching or burning?
No.
No? Okay. And have you ever had a UTI?
I have, yeah.
Yeah? Okay. So do you remember any of those symptoms?
Yes.
Okay, so all the symptoms would be like pain or frequency, urgency, dripping, anything like that, okay? So you just need to let us know if it's any cloudiness, okay? Okay. Okay. So I'm going to say a quick peek, and it'll be fast. I don't see any redness or sores. Perfect. Okay. It looks great, okay? Okay. Since I did touch your peri area, I'm just going to go switch out my gloves and perform hand hygiene, okay? Okay.
redness or discharge. I also
Okay.
need to ask if you've had any itching.
You doing okay still?
Yes.
Okay.
So I'm not seeing any of those things.
So I'm just gonna ask you a few more questions about the peri area. Did you have any, or when was your last menstrual cycle?
Last month.
Okay. Perfect. I'm now just gonna go down to your legs. Okay? Okay. You just let me know if your pain gets too intolerable. Okay?
Okay.
Can you raise your legs for me, up and down? Perfect. And can you do it with some resistance? Perfect. And then can you pull your feet towards me? And then push. Perfect. I'm gonna check your heel pulses.
Alright, so I'm gonna go in here and check
Perfect.
little pulses.
And then your posterior tibialis. Perfect. Both of those are equal bilateral by 2. And then your dorsalis pedis.
Plus, or 3 plus
Which are
5.
very strong, equal bilateral by 3. I don't see any redness between the toes. Look really healthy. The cap refill is less than 3 seconds, which is great. No joint tenderness or swellingness over here. Do you feel any joint pain on your legs?
Dorsalis
No.
piece.
No? Okay.
I always get those two.
And I also don't see any unblemishiness in the skin. Nothing on any bony provinces or calf
I'm
tenderness.
gonna ask for edema anywhere on your body.
Can you close your eyes and tell me what toe I'm touching?
My big toe.
Perfect. And what about now?
My big
What
toe.
about
Perfect. I don't see any redness on the bottom of the feet, no bruising. As for your legs, I do notice that you do shave. So whenever the hair does grow in, does it grow normally or does it grow in any patches?
your hair growth?
Normally? Okay, perfect, perfect. So now I'm gonna have to have you roll over on your side just so I can do your lung sounds, okay? Okay. Okay. You just let me know if you're in any pain, okay? Doing okay?
Yes.
A little closer. For now, you said it's just about a 2.
Breathe in.
There's no blood, no active bleeding, there's no discharge.
Breathe in.
But there is some redness there.
Breathe in.
So I'm going to go ahead and make a note of that.
Breathe in.
Chart. I'm also going to check for CSM and CRT in the toes. So I want to make sure
Breathe in.
that your toes have
Breathe in.
good cap refill like we did with your fingers. Less than a second.
Breathe in.
And I'm just going to ask
Perfect. All the lung sounds clear. There's no purpling or moisture inside the lungs, which is great.
the other way.
I don't see any redness on any bony provinces on the back side, which is great. Nothing on the hips. How are your hips doing?
They're good.
Good, okay.
Yeah.
So I do have to check your buttocks area, okay?
Okay.
I'm just gonna check the anus
So
for any
your legs are
hemorrhoids or
both
fissures,
bilaterally strong.
Okay.
or any redness or sores, okay? Okay. Move very quick. I don't see any fissures, hemorrhoids, any sores. The moisture is nice and the temperature is normal for the back side.
One more thing I'm going to check with your feet is I'm going
Don't
to
see any
Allison,
things on the ankles. And your skin color throughout your body is also normal and true to ethnicity.
signs of fungal infection,
So I'm gonna turn you back over.
redness in the
Perfect.
feet, like athletes.
You doing okay?
Yeah.
Okay.
I don't see any of that.
And just a quick question, do you have, or do you know if your level of function right now is normal compared to before you got here?
Yeah, it's
Pretty normal? Okay. And do you need any assistive devices for being here? A walker or a cane?
no.
No, or not at home either?
No.
Okay. So since I did touch your buttocks area, I'm just gonna go and switch out my gloves, okay? Okay.
Which foot is this? Which foot is this? Feel all that.
Okay. You're doing great. Throughout the whole assessment, I didn't notice any wounds or drainage, no rashes, or I did check skin turgor. There was no turgor, which means that you're drinking enough water. I don't see any edema, so there's no pitting. Your IV site looks great. Get the side view. Again. Okay. And then your collar is just right here, so just press it whenever you need me, or whenever you need to use the restroom, and I can help you if you need it. I'm gonna put the bed at the lowest position. Make sure the bed is locked. All right. You comfortable?
Yes.
Okay. Perfect. I'm just gonna perform hand hygiene and then open the curtain and then exit, okay?